A luxury senior living community in Maple Grove is linked to cases of Legionnaires disease.
Over the past month, 2 residents of the SilverCreek on Main contracted the disease, and Delane Cleveland joins us now with more on the investigation. Delane?
Mike and Alex, Legionnaires disease is a bacterial pneumonia with symptoms such as muscle aches, shortness of breath, and fever. The State Department of Health is working with Hennepin County and the city of Maple Grove to identify the possible sources. An initial investigation has found that the source of the bacteria was most likely within the building's water system.
There's lots of different, ways people can be exposed to Legionnaires, but when we have 2 people in a single facility, that means that we want to look into, is there something in that facility's water system that may need to be addressed, and so that's currently what's being assessed right now.
The first resident's symptoms began on August 22nd. 3 weeks later, symptoms popped up in a second SilverCreek resident. Both are hospitalized and recovering. Upon being notified, SilverCreek hired a consultant to evaluate and address the findings. Meanwhile, experts say the Legionella bacteria is common, and most people exposed to the bacteria don't develop Legionnaires disease. However, people over the age of 50 or those with weakened immune systems or chronic health conditions are at increased risk. That said, Maple Grove residents shouldn't be alarmed.
The Maple Grove water supply is safe. It meets all the safe water standards, so this is not a concern for the general population of Maple Grove. It really has to do with this facility and kind of looking, initially at least we're looking at their water system and what issues there may be there.
Until they identify the source, the Department of Health has recommended a number of measures to help protect people who live, work, and visit SilverCreek. That includes not showering, not drinking the water, and shutting down the pool. State health officials say Minnesota typically sees between 50 to 60 cases of Legionnaires disease a year. That includes the 2016 outbreak in Hopkins that resulted in 1 death.